Diagnosis of hepatitis C virus. Unfortunately, diagnosis of hepatitis C virus in patient is a little bit difficult. Why? Because as I had said, that hepatitis C virus almost affected the patient in a chronic form. The patient might not suffer from any clinical illness. He may be diagnosed accidentally during any routine work. The patient may undergo different fluctuations, as we saw in the curve. The liver enzyme sometimes may be elevated, the liver enzyme might be low. Of course, as I had said, the only method for choice to diagnose a case of hepatitis C virus is detecting the hepatitis C virus RNA in the blood by the polymerase chain reaction and measuring the viral load or the circulating amount of the virus in the blood. The diagnosis of chronic hepatitis C virus is suspected in patient with any of the following. Suggestive symptoms and signs, which is very important. If the clinician are suggesting these symptoms and these signs are related to hepatitis C, incidentally noted elevation in the liver enzymes, as I had said, accidentally liver enzymes are elevated, previously diagnosed as a case of acute hepatitis. He was diagnosed before as a case of acute hepatitis. Diagnosis is confirmed only in hepatitis C virus is by finding the antibodies to hepatitis C virus and positive hepatitis C virus RNA for 6 months after the initial infection. Meaning that if I found the antibodies of hepatitis C virus in the serum of my patient by the ELISA technique, it is a must to ask my patient to do hepatitis C virus RNA by the polymerase chain reaction to confirm my diagnosis. Because as you all know that the ELISA technique or the detection of the antibody by the enzyme-linked immunosorbent assay, it has a certain percent of false positives and false negative, but of course in the use of the polymerase chain reaction or the hepatitis C virus RNA detection in the blood, it is a method of choice and it is highly specific and it is highly diagnostic. Screening test for antibodies to hepatitis C virus, anti-hepatitis C virus, carried out by the enzyme immunoassay. Just for screening, I will do the ELISA technique. In testing of anti-hepatitis C virus, the following has to be considered. Negative results may be obtained in the early seronegative patient. If the patient is exposed to infected blood and he knows well that this blood is hepatitis C virus positive, the negative results is obtained in the early seronegative. This means that this patient, during early infection, I will find negative for antibodies. Okay? A positive test does not distinguish between acute phase, chronic, or resolved, infected, or recovery. I have mentioned this before. If my patient comes to me with a test of positive antibodies against hepatitis C virus and he looks completely healthy, this result will not differentiate between if this patient is in the acute phase or if this patient is in the stage of chronicity or this patient undergo complete recovery. I cannot differentiate by the positive test. Therefore, in this condition, the hepatitis C virus RNA testing to detect the viremia, to detect the viral load circulating in the blood is necessary to confirm current active or chronic hepatitis C virus infection. The presence of the viral load in hepatitis C viral infection is very important, which is only done by the polymerase chain reaction. Some hepatitis C virus infected patients have poor serological response. For example, chronic hemodialysis patient. Unfortunately, the patients who will undergo hemodialysis twice a week, sometimes 3 times a week, these patients, if I'm looking for their antibodies against hepatitis C virus, which is simply by the ELISA, they might be almost negative, or their serological. Why? Because their serological, because of their immunity is very weak, their serological response will be very low. Therefore, such patients, I can detect the presence of infection by testing for the hepatitis C virus RNA using the polymerase chain reaction to confirm the test. Hepatitis C virus RNA detection and quantification, PCR, are used to confirm the presence of active disease. So the PCR is very important in such patient. Why? To confirm the presence of active disease, Diagnose infection in early seronegative phase if I am clinically suspected that this patient have hepatitis C virus and he is negative, using the ELISA negative for antibodies, I have to do PCR to diagnose the infection in such seronegative patients. Diagnose infection in patient with poor serological response as those of hemodialysis patient. Following the acute self-limiting infection, my patient was in an acute stage and I want to be sure that his viral load is very low or he undergo complete recovery. I have to do PCR for him. Following acute self-limiting infection, resolution is marked by the disappearance of the hepatitis C virus RNA. Measuring the viral load, which is very, very important point this period of life or this period of research. Why? Because measuring the viral load by the quantitative, to know the quantity of the virus circulating in the blood, is very important to monitor the response of the antiviral therapy, whether it is ribavirin, interferon, pegylated interferon, according to the regimen the patient used. For most hepatitis C virus RNA assay, the lower limit of detection is at least 50 international units per ml. If a quantitative assay does not have the level of sensitivity, a qualitative assay can also be used, because the qualitative assay can detect very, very low levels of hepatitis C virus RNA, even 10 international units per ml, and provide results as positive or negative. So the detection by the qualitative assay, PCR, is very important to detect the level of the circulating virus in the blood, or the stage of viremia, or the viral load. Qualitative tests can be used to confirm the diagnosis of hepatitis C or sustained virological response. The sustained virological response, these are the measures which are done during the patient regimen of treatment, meaning that the qualitative test again can test to confirm the diagnosis of hepatitis C virus or the sustained virological response. What is the sustained virological response, or SVR? It is defined as no detectable hepatitis C virus RNA at least from 12 to 24 weeks after complete treatment on the drug regimen. For example, if the doctor gives a certain regimen to his patient, and after he finished this regimen, he has to do hepatitis C virus RNA. If the hepatitis C virus RNA are not detectable from 12 to 24 weeks after the completion or after the complete regimen, this is a very good sign for the treatment or for the response of the patient to the treatment. Hepatitis C virus genotype is determined before the treatment, because genotype influences the course of duration and the success of the treatment. Of course, the genotype is very important to be known. Liver biopsy is useful for one or more of the following. Liver biopsy have very important points, or have a very important importance in the diagnosis, but as you all know, it is interfering procedures, and we do not prefer anything of invasive procedures. It is useful for one or more of the following: for grading the inflammatory activity of the patient, to what stage of inflammation is his liver; staging of the fibrosis or progressive disease, which can sometimes help to determine which patient to treat and when; to exclude other causes of liver diseases, it might be hepatocellular carcinoma or whatever. So, it is useful for one of the following: grading inflammatory activity, staging fibrosis or progression of disease, which can sometimes help determine which patient to treat and when; to exclude other diseases of liver disease, as for example hepatocellular carcinoma or parasitic infections or whatever. However, the role of liver biopsy is evolving in hepatitis C, and biopsy is being replaced by non-invasive procedures. As I had mentioned, we are now trying, or all the scientists are trying to get rid of any invasive procedure. So now they can use ultrasound elastography, magnetic resonance, for example, elastography, and serum markers of fibrosis, as well as scoring system for fibrosis based on the serological markers. So again, the role of liver biopsy is very important, but nowadays we are trying to not use any invasive procedures. We can use ultrasonic elastography, we can use magnetic resonance, or different serum markers for fibrosis. Other laboratory tests, liver function tests are needed if not previously done. Liver function test is very important to monitor and to control the level of infection in case of hepatitis, including ALT and AST, alkaline phosphatase, the bilirubin, all liver enzymes are very important. Other tests which can also be done to indicate, to evaluate the disease, whether it is severe or it is chronic, including the serum albumin and the platelet count. Patients should be tested for HcV and other forms of hepatitis because unfortunately sometimes the patient have combined infections of hepatitis B and hepatitis C or hepatitis C with HIV, so it is very important to test for other causes of hepatitis. Infection because transmission of these infections are exactly the same, so we have to exclude these infections. So again, other laboratory tests include different liver functions, ALT, AST, liver bilirubin, alkaline phosphatase, and serum albumin and platelet count. If symptoms or signs of cryoglobulinemia, what is cryoglobulinemia? Which is the presence of abnormal proteins are circulating in the blood. These are always developed during the chronic stage of hepatitis C, and the presence of this abnormal protein may help in the diagnosis or also in staging of hepatitis C. So cryoglobulin levels and rheumatoid factors should also be measured. High level of rheumatoid factors and low level of complement suggest cryoglobulinemia, so it is a very important cardinal signs or very important diagnostic laboratory test which help to stage the level of chronic hepatitis C virus infection. Screening for complication. Patients with chronic hepatitis C virus infection, unfortunately, they are highly liable to develop hepatocellular carcinoma, so such patient has to be screened from time to time to detect the advances of fibrosis, cirrhosis, should be screened at least for 6 months, and to exclude carcinoma, which is very common as in case of hepatitis B virus infection.